Welcome, world, to the Johnny and David Show, broadcasting live from Chicago, Illinois at the National Medical Association Conference, where stethoscopes shine, scrubs are crisp, and brain power is off the charts.
Listen, I haven't seen this many lab coats since that one time I binge-watched Grey's Anatomy. But this is real-life brilliance, baby! We are surrounded by the best and brightest doctors, educators, healthcare bosses, and future medical legends.
Day one is in the books, and whew, it's been busy. We've been walking through a sea of white coats, shaking hands with some of the most influential minds in healthcare. And let me tell you, these folks came ready. The drip, immaculate, the knowledge, next level.
I even saw someone with a rhinestone stethoscope. That's not a joke. And they had a whole crew. Looked like Beyonce's backup dancers, but they were dermatologists.
All right, let's run it down. Day one was all about connecting, exploring, and leveling up. We saw dozens of vendors showcasing groundbreaking medical tech, from AI-powered diagnostic tools to VR surgery simulators.
The NMA has contracted K.L.P, a leading childcare service provider, to organise a fun-filled and enriching programme for the youth of attendees at the NMA 2025 Convention and Scientific Assembly. K.L.P has delivered exceptional childcare programs since 1986, earning a sterling reputation for its services with associations and corporations nationwide. The 4-day Camp and Amazing program offers day and evening sessions, ensuring a comprehensive and engaging experience for the young participants. K.L.P maintains chaperone to youth ratios that guarantee safe and professional care. Qualified chaperones, including nannies, nurses, and teachers, are certified in first aid and CPR. Program fees cover transportation, activity admission fees, daily lunches and dinners, 4 t-shirts, and insurance. Each day, parents drop off their child beginning at 7:30 a.m. and pick them up by 8 p.m. Please note that the schedule of activities are subject to change.
Presentations hosted by exhibitors and/or non-exhibitors in 2 presentation theaters located in the exhibit hall during exhibit hours. Companies will showcase new products and/or treatment options. Presentation theaters will feature non-CME presentations with meals and refreshments provided for each theater. During this educational session, attendees will learn about an alternative PrEP option to help prevent HIV in their patients. The program will review important information, clinical data, and dosing and administration, and provide guidance on identifying patients who would benefit. In addition, the program will also feature a patient ambassador who will share their personal experience with this PrEP option and discuss how it impacted their life. Learn about challenges in addressing vaccine-preventable disease VPDs in vulnerable U.S. adults. Our presenter will highlight differences in VPD BR.
You got to have a resource like a hospital system that's providing that new technology. 2, practitioners that are aware of it. It is something that is so unique now for a provider to have that type of relationship with any hospital system. Because normally what they say is you don't have enough revenue generating units and you're not seeing enough patients and blah, blah. They're not looking at the quality of service that you're providing and more importantly the outcomes that are positive for you and your patients. Okay. Instruct your patient to see a doctor following signs are present. Skin blisters, thickening, discoloration, cracking, cold numbness or any abnormal feeling of the feet, clogged toes, thickened tip of toes, or toe deformity. Sometimes this is blatantly obvious. I call that you should never wear sandals under any circumstance but. So when you see this, do not, this is for the primary care doctors in the room. Make sure your patients take their shoes off and that you actually evaluate their feet at every visit if they're diabetic. That is what we say we like to do. Sometimes we get rushed, it doesn't happen. But if you do see deformity, claws, you see fungal toenails, don't just ignore them. Put in an action plan so that it does not become a problem, an infected ingrown toenail, etc. That's an opportunity to do an early intervention. I tell patients it doesn't sometimes necessarily require you to go to the doctors. It just may be a matter of routine foot care, getting a mani-pedi. I say, go get the $45, now $65 manicure, stuff a piece of cotton between the toe, and that's the way they do. I see this, they come in, they got tape around it, they have been very creative in dealing with this problem. Won't mention it, it's become something that they just live with, and they don't even really consider it's not on their problem list, their problem mine. It's just something I have to do. I have to put cotton between the toes because they're losing. And so they need to make sure you have that discussion with the patient. If they have broken, And nowadays, you know, they take a picture of it and send it to you, and you say, yeah, you might have a problem, but how long has this been going? This was 2 days ago. Why are you just bringing it to my attention now? So, you know, these are the things that we need to share with patients that have that ability to communicate with. Swelling or discharge from the toe, foot, or leg without pain, one-sided swelling, or swelling on both feet and ankles is going to be very important that you have something you can elevate your foot on and comfortably clean and dry between the toes. Change and rotate shoes often to avoid fungal bacterial infections, and wear appropriate over-the-calf support socks or footies. Number one thing I tell patients, wear over-the-calf support socks, not compression socks, not the ugly beige you cannot get on and very difficult to get off. Compression sock, I say the point of the support socks is that you never get to the stage of needing the compression. I say this prevents swelling, edema. There's no space in the foot to collect fluid now. But more importantly, they're more concerned about varicosities and varicose veins and the cosmetic appearance. So I say wear the over-the-calf socks. I always pull my pants up and show them that I wear them all day, every day, and I got sexy legs, no veins. So, you know, patients, when you demonstrate, not only am I telling you to do this, I do this as well. Yeah. And so then they'll come in proudly and show me the next time they come in. Where do you get these? Because they're difficult to find now. People don't wear socks. So I say go to Amazon, order 1 or 2 pairs, see which ones you like, then order one in every color, every style. So you have casual, you have dress, so that whenever you're thinking about socks, you're putting on the correct sock. I say those halfway up the ankle, cut off your circulation socks that you used to wear, throw them away. Don't have them as an option, so that you will never come in complaining that your legs or feet are swollen. And I throw your sock down, there's a big line, and it's just fluid collected because the sock is actually a partially acting as alternative. So you don't want. When I see him, or every time he comes to the office to see him, you know, I spend more time on his emotional and mental status because it has really just changed his life. Having that amputation, he uses the term, I'm less than a man, I'm half a man, nobody wants a one-legged man. You know, and I try to flip it and make it positive. I said, you know, a one-legged man can do things a two-legged man can't do. So you need to promote that. And so, you know, I try to flip it, but, you know, it's the reality that just damages his life. Okay, try it, ladies. One-legged man. Okay. 60-year-old black male physician represented this case last year. Why am I revisiting it? Because he's still having problems. He is still not healed. Okay, he had 1 toe amputated, then 3 toes amputated, then the anterior portion of his foot, and he still had to go and get routine grafting. He's been in a graft program for now over a year since the last surgery. It is still not healed. It is still not healed. So he works in my office. He has one of those scooters that he rolls around in. You know, when he comes into the door at the end of the hall, I can hear him rolling down the hall. I say, here comes Scooter. But the problem is, this gentleman had access, had insurance, all those things, didn't go, wouldn't go. When he was first diagnosed, and I told this story, he came into the office and he was seeing patients. My nurse came and she said, the patients are complaining. I said, about what? They say, he smells bad. And it was overwhelming, you know, it was an anaerobic infection, overwhelming. So I told them, I said, well, I think somebody went in the bathroom, one of the Real Housewives things. And but now we can't do that. That's not an interesting storyline. They don't want to talk about that. And so now he's limited as to what he can do, how long he can do it, etc. So this is a real phenomenon. It impacts us each and every day. The thing I want to emphasize once again, communication with your referral physicians, your primary care docs. Make sure that you let them know that you are available to see their patients, and for them to let you know, I'm going to be sending you my patients. So it's a mutually symbiotic relationship that works out well for everybody. Thank you very much for your time and attention. I greatly appreciate
you. This has been a great morning, huh?
Yes.
One thing I want to do before we start, I want to give a round of applause to this section.
Yes.
This is our section. As our chair, Dr. Jefferson, has stated over the last 3 to 4 years, we may be the smallest section, but it will be the fastest growing section.
That's right.
I'm gonna just share a little story with you all about how we really got here. I think it was about 4 years ago when we was in Atlanta. I never did envision the fact that we would be where we are today. Talking about having a symposium on limb salvage and limb preservation that is being spearheaded by the podiatry section. When you travel around the country, you go to these different meetings, most of the symposium are run by vascular surgeons, general surgeons. Rarely do you see podiatry. So we was at the Atlanta meeting, and I was walking around the different halls into the different lectures, and I see all the platforms, and I see diabetic lectures, and I see these panels, but I don't see podiatry. How can you talk about diabetes and wounds in the feet and the ankle, but don't have podiatry? So we come back, our section have our little meeting, and I made a proposal to everyone. I said, you know what? Where's our next meeting? And it just happened to be in New Orleans, my hometown. So I looked at the picture and I said, you know what? This must be by design. And so we started the first limb salvage symposium in New Orleans, which is led by the profession of podiatry.
That's right.
That's unheard of, that's unique. It is something that needs to be celebrated. And so when you see where we are today, to be able to have the president-elect, Dr. Roger Mitchell, that says a lot about our profession, that says a lot about where we stand in this organization, and also lets us know what our purpose is as far as it means in this medical community. So I'm grateful and I'm blessed to be part of this wonderful organization, to be a co-chair, and we are fortunate enough to also have the president of the APMA here, and we're going to try to move this pendulum to the next level. The days of not discussing the elephant in the room is over. You either on the right side or the other side. We have to make a decision. So in the 28 years I've been practicing, I've steered from podiatry, now limb salvage surgeon. I never knew what that really meant. But when you're in a community like New Orleans, Louisiana, when you have so many festivals, when you have so many parties, every week there's a party, and it's like 3 or 4 parties on a Friday, Saturday, and Sunday. And so what is the community supposed to do when you're talking about traditions of the culture? You know, no city is great. Every city, urban America has its unique challenges, but I wouldn't want to practice any other place. And so my job today as a limb salvage surgeon is to bring the surgical component of what I do, what can be done, and how it should be done. And so an organization like the NMA and podiatry, and as you heard from Dr. Roger Mitchell, that we are going to be part of this platform. And I'm going to challenge this section. I'm going to challenge our leadership that we have to be ready. When we finish with this meeting here, we got to get to the drawing board. Dictionary, if you look at that word, my picture's right next to it. Because, there you go. Because let's be real. I am a black limb salvage surgeon working in the Deep South, on staff at hospitals, on staff at surgery center, and I'm a problem. Just like you stated, my job is to save limbs, but that may not be the agenda of others. And that's when we have to continue to fight and move forward. Like John Lewis said, there's good trouble. Yes. And that's what we are, we're good trouble. So don't ever get discouraged. We're going to continue to get better. We are growing as a section, and we're going to continue to move forward. But others have to work with us. We have to work with them to move not only this section, but the microcosm of black podiatry forward. To let them know that we're here, we've been here, and we're not going anywhere. It's simple as that. I tell my husband all the time, if you want to get rid of me, bring some body bags. I'm not going. I'm gonna continue to be there. I grew up in the New Orleans community, born and raised, and when you think about the community where I practice at New Orleans East, that community was heavily stricken by Hurricane Katrina. They feel left out. They feel like no one cares for them. I'm sure all of y'all saw the pictures on CNN. We was called refugees. So you know what? Someone needs to be there to fight for them, just like they have fought for me. They patronize me every day. They come to my practice every day diligently. And you know what? My goal here in this organization is not only to fight for them, but to fight for all of us around this country. So I'm going to start my lecture. I'm going to like changes just from amputation. Some patients don't even realize that when they go to the OR, they come back, they didn't realize their limb was missing. Because it was told to them that, oh, we're going to save it. We just got to do a debridement. But we don't know what happened to them in that OR. But now you get a different story. So just imagine waking up that morning and realizing your limb is gone. You came into this world with a right and left limb, and now you only have one. The things that we kind of take for granted, getting up in the morning, driving a car, being able to take a bath or a shower, living, being able to live, that's all of a sudden has to change, because now you most likely have to either live with someone or someone has to live with you. The ability to get up and reach the kitchen cabinet to cook, to make a bowl of cereal, we take those things for granted. So now depression gets in. Alcohol, substance abuse, it happens. And we see it too many times in our community. The need to be greater used to do ABIs annually. And so those ABIs, those circulatory numbers, would allow us to compare from year to year. So if I know that those numbers are decreasing and getting worse, I can refer that patient to a vascular surgeon. We can do more testing to prevent, not necessarily cure, but prevent an ulceration from coming. The disinvestment in the African American communities has greatly fueled the amputation epidemic in the Black America. Dr. Beckery talked about this earlier, PAD awareness. In 2019, a Congressional PAD caucus was formed to create awareness to Congress and communities so that there could be improvements in research to reduce the number of amputations. U.S. Representative Donald Payne, the chair of the caucus, introduced the Amputation Reduction and Compassion Act, H.R. 2631. And under that act, I'm looking at this foot, I said, do I amputate the second toe to give me more room to kind of navigate so I can close it? And that's what I had to do. I rather amputate a toe in order to save the foot. These are the things sometimes you have to do. If you look at the second case, this guy had this ulcer that was on the plantar part of the foot, but then also too, you look at his big toe, the big toe is in an elevated extensive position. So we know walking on that foot, he's constantly getting plantar pressure. So not only did I debride the ulcer and clean that up, but I put a pin in his foot to straighten up the toe. And you can see he did well. The first case, woman comes into the office, spider bite. Infection going up to the ankle, to the leg. We get her admitted, debride it, put a graft on it. She did well. The second case, 45-year-old male, he's on vacation. Disney World with his kids. We can't handle this. So he got to drive 6-7 hours back to New Orleans. He comes straight to my office. Straight to my office. So you run the risk of him getting blood clot. You run the risk of him getting septic. But this is what we see. This is what comes in constantly in my office. He did well. Now he's able to continue to work, provide for his family. 77-year-old black female. When you think of everything, diabetes, high blood pressure, end-stage renal disease, dialysis, poor circulation, had a wound on the foot, home health puts the wrong dressing on, emasculates the skin, now you got bone exposure. And if you look at the picture on the right, I'm looking at your foot on the left, I'm thinking to myself, that may need to be amputated. I see the patient in clinic on a Saturday, tell her to go to the ER. ER said, we don't see nothing. Send her home. I don't see what the ER doctor told me. I don't see what Dr. Williams sees. I'm like, oh, okay. Told the patient, go home. I'm going to just send you back in 2 more days. And that's what she did. She sat in the ER for 12 hours, thinking that the infection was going to go down. Never happened. Took her to the emergency room, had to open her foot from the toes all the way to the midfoot, almost to the heel. And if you look at the third picture to the corner, you can see all that red tissue she ended up walking on it. So it granulated too much. So I said to myself, she's not listening, not being compliant. Let me send her to the wound care center. She goes to wound care. They tell her that they got to amputate the leg. So I'm doing due justice. Send her to the wound care center. They got all the modalities just to get the wound healed, but you tell her you got to amputate. I told the patient, I said, you're under my care, we're going to get it done. As you can see, she healed. The second case, probably one of the strangest cases I've seen. This was a gentleman that was already being treated by a wound care specialist, wound care center, and was getting home health. So how does a patient get bags? All the black stuff that you see is bone. Bone. So if you're under someone's care, how does it get to this point? So these are the struggling issues that we have to deal with as podiatrists, as clinicians. These are the struggles. And it's easy to walk away. It's easy to say, look, I'm done just like anybody else. But a case like this, you have to fight the hospital, you have to fight the ER physicians, you have to also have to have the human side of being a physician. Sometimes they get lost when we're chasing the mighty dollar. We're trying to be the best of the best. It's not about that. It's about doing right for these patients. And then my most interesting case that I've seen, this was a 27-year-old female who came to the ER, diabetic, sugars over 650, and when she came into the hospital, they told her that they wanted a TMA done on both feet. They was worried about her being septic. And you can imagine sugars that high, but her Medicaid insurance did not pay for the insulin pump. So she's constantly walking around with sugars of 600-700. So now you got everybody in the hospital who's scared to want to touch her. From the case, and I was advised to do the amputation of both feet. And I was able to persuade the infectious disease doctor and internal medicine doctor. I said, give me 2 weeks. Let me take it to the OR. You see the final results. This is what we can do. But we have our unique challenges. So these challenges is just going to make us work even harder. It's going to make us become better physicians. And it's going to improve our community. So as I conclude, I ask everyone today, with motivation, be uplifted. Keep yourself armored in prayer, because that's what's going to get us through the most difficult times. These two beauties right here, that's what gets me up every morning. Baby girl going to Southern University in Baton Rouge. Young man is following my footsteps and going to the St. Western High School. So today, this morning, as a blessed man. Because God has given me every opportunity to be the surgeon that I am today. And without His blessings, and without Him giving me the gift, I would not be able to do the things I do today. I would like to thank every last one of you all coming to our session, being part of our session, and look for the brighter things to come from the podiatric session of the NME. Thank you so much.
And Wade, and some great presentations, and just for Dr. Fakaridi, some of the reasons why we have such a low amount of podiatrists in Mississippi is because when I graduated from residency, there were 4 states that could not do ankle surgery: Alabama, Mississippi, South Carolina, and Massachusetts. And the first 3 we shouldn't even mention all together at one time. We knocked out South Carolina in 2018. We just got Alabama. And we're working on Mississippi. I really think we'll get Mississippi before we get Massachusetts. Those are some of the things that happen, because if you go through a 4-year residency, and Massachusetts is really awkward because we actually have a residency program at Harvard. So that was one of the things when I returned to South Carolina. Everybody thought I was crazy. Why would you go there after graduating from the University of Penn in residency? And I said, because this is a problem. So a lot of us fought for it, and we got it. But there's always, I always tell everybody, when you see a problem, I see opportunity, right? So sometimes you have to think outside the box. So we had podiatrists that were going to Georgia that were doing ankle surgery, some that were going to North Carolina, and then I myself did it right in Columbia, South Carolina, because there's something called the supremacy clause, which means that the federal government, if you're working in one of the institutions, they can supersede a state law. So therefore, they did not have any foot and ankle surgeons at Columbia in the VA. So I would drive there every Friday, an hour and 45 minutes away from my practice. My CPA told me I lost a lot of money, but that's okay, because I was fighting, I was doing it for the good of the state. But I would drive every Friday to Columbia, and I would do ankle surgery. And then when this thing came up again, and they said, well, some are going to Georgia, some are going to North Carolina. For every podiatrist, it comes down to data. You've heard this being said, preached over and over again, right? We showed that for every podiatrist that's not doing ankle surgery, the state was losing $1.2 million. And then we said, just egg in the face, you have a podiatrist doing it in Columbia, our state capital. And they hadn't done their homework. No, he's not, that's malpractice. No, he's doing it at the VA. And he's doing it for $50 a case, because that was my contract rate. $75 the first time I saw him, $50 after that. So I see you the first time, I work you up, $50. If I was trimming toenails, trimming calluses, or doing ankle surgery, $50 was all I was getting. But that's why my CPA said, you're crazy. But that's okay. And guess what? And that should help Mississippi also. Because we had one of our board members just speak for Massachusetts, and they took our strategy with 3 pillars, okay? We need to be in the room of the people who are making the decisions, right? That's so important. So we're looking at getting in front of those decision makers with critical policy. And we're focusing on PAC efforts to ensure that we're getting there. And we're also being more proactive than reactive, right? We keep seeing legislation that comes over, but then everyone fights and nobody's kind of being proactive with it. We have to stop doing that. We're increasing our media engagement, and we're telling our story. Everybody has been telling their stories up here, and that is so important. You know, data is very, very, very important. But it's also, you have to be able to relate, because when you're in front of these legislators, they react a little bit better when you're giving a story than just throwing numbers at them sometimes. Give them the paperwork with all the data on it, but also you have to make sure that they understand where we're coming from. So we're investing in data analytics, and you'll be amazed that when you start talking with people and you're sharing your story, how many of these companies, everyone that we work with every day are having the same problems. literally. So again, this public promotion of podiatry, ensuring that we have a strong podiatry workforce, because again, we're having problems with getting our seats filled, right? So as I always state, you know, if you want people to come into podiatry, they have to see success. I remember I was actually the liaison for SNAPMA and for NPMA. So I remember when I was at Temple, I would have to go to both the APMA meetings and the NMA meetings. And then when I look around the room now, I don't see as many young people here. So I'm going, we have to get them engaged, because that is what made me want to be a part of APMA, and now I'm coming back to AMA. And I'm going to share a very, very quick story. I remember my second year, we were taking pharmacology, and some of our students, African American students, were having problems because they failed and they wanted to repeat them. But we knew some other people failed and they were going to move on. So we called Dr. Jeter and Dr. John Dale Jenkins. And guess what? Those students moved on. That's the power. That's what I remember. That's why I wanted to stay a part of APMA and NMA. And there's Dr. Jenkins there. And then you have the godfathers like, you know, Dr. Harkness, who gave a lot of money away. And a lot of states will not apply for this. We awarded more than $50,000 to 10 states. And especially those states who are still fighting, like Massachusetts, like Mississippi, to modernize their scope. So again, we're supporting the Massachusetts Foot and Ankle Society bill. I gave you the story that we have residency programs there, and they're doing ankle surgery, but once they graduate, they can't. That's why, again, we have to unite. We have to unite with AMA, NMA, ALA, because I think that with Dr. Fakaridi, when you get a below the knee amputation, greater than 80% of those patients are dead, you know, within 5 years. But guess what? 44% of those patients who have just a diabetic ulcer are dead within 5 years. A diabetic ulcer, how many ulcers have you seen up here today? We have to have access to these patients. And again, when I go, I'm always talking to everyone. You know, I don't care if you're general surgeon, you're internal medicine, hospitalist, I'm talking to everybody. Because I just have a lot to say. So, and I'm not being bold and sticking my chest out, but when I'm trying to, they have to understand my story. In South Carolina, when I come and see a patient that has Medicaid, I'm not being reimbursed for this patient. If I do surgery on this patient, I have to follow this patient. I'm putting myself and my other physicians at risk because we can't abandon a patient, right? But we would love to see these patients. But the state does not force Medicaid to pay us because Medicaid does not view podiatrists as physicians. Now, we've been fighting this for 18 years. The HELP Act, helping to ensure life and limb saving access to cardiac physicians. I told you I was legislative chair. I can rattle these things off. I can rattle off all the numbers and everything, but these are the things we've been fighting for. So these are the problems in Mississippi. That's why you have these high amputation rates. Again, if you give us access to these patients, we can decrease it. We're also call us the special forces because we do things that people don't even realize it. The Nevada legislation was trying to merge podiatry into the Allied Health Board. We're physicians. And I know we're R3 physicians considered by the federal government, not R1 with MDs and DOs, but we're R3 physicians. We are physicians. So to try to put us in the Allied, that's a smack in the face. So we fought those things and we passed. Same thing, Optum tried the same thing. Right? And we recently just won that. So again, we're doing things behind the scenes that people don't realize. And understand, I started off with the APMA PAC. That is important. None of this stuff happens without money. I hate that. I hate to say it, but it's real. You cannot get in front of these legislators without providing money. So therefore, you have to get back to the PAC. And then we're also trying to partner in Georgia. We listen. APMA listens. So Javan Bass, who is a delegate for Georgia, stood up at the House of Delegates, said we're having a problem with call schedules. They want podiatry to do call, but they don't want to pay podiatry. That's not going to happen. So therefore we're helping out to make sure that podiatrists are reimbursed if you're going to do call. Now, South Carolina always uses us as an example. So I always lead is when we show them, then they they will come. So I started working at the hospital, and I was working with the hospital, but I was telling them you cannot consult us. Now, and here's the thing, we get the crumbs, right? The 2.5% increase. Well, 2.5% increase is not much when you've been getting a decrease every year, and again, your expenses keep going up every year. And when the president of AMA came and spoke at the House of Delegates, again, he told his story, how he lost one of his, ear, nose, and throat doc. He lost one of his associates because they said, look, I can't work for you anymore. I got to go work for the hospital and get some insurance and stuff. Again, that's a story that we all hear. This impacts us all. Because again, private practice, every year the hospitals get an increase. Every year. Private practice doesn't get an increase every year. So a lot of these private practices are being bought out by super groups, being bought out by hospitals. We see these things, nothing against that. If you work for one, that's fine. But I know in podiatry, we have a large group of private practice physicians. So we need to keep these things going. But APMA fall, we always send things in. But again, we're looking to join with other organizations. So we had 90 plus healthcare societies. We've signed on different bills. The ARC Act, things like that, with Dr. Proctor Reedy was speaking of. We don't just look at things that affect podiatry. If it can help someone else, we're signing on. So the physician fee schedule. So now, again, we're going to have a 4% increase in podiatry. That's, pretty good. But the other things that we're looking at outside of that, when you're looking, Dr. Brooke Bixby used to work with the RUC. So the RUC kind of decides what you're going to be reimbursed for the RVUs, right? So with AMA. Now, for our arthrodesis codes, we're going to get a proposed increase. Again, this is things that APMA does. But before, there were other things that we had to fight that they didn't want to pay for total ankles or different joint replacements. But these are the things that every day that we're fighting for. And MIPS, how many people love MIPS in here? Yeah. Guess what? None of us like MIPS. And guess what? All of us want it gone. So that's why these are low-hanging fruit. These are things that we all agree on, that we can go in and go, let's fight on these things together, or have a paper written together that is signed by all organizations. Listen, how many of y'all have Instagram? How many of y'all have, she was just calling us out. And she was like, they want to see us, right? They want to see some of the younger members. So again, when I look around, we need to get some younger NMA members here. And that's one of the things I'm going to take back to APMA, is that our minorities need to be joining NMA. But then I'm also put the same thing on NMA. If you're a part of NMA, you need to be a part of APMA. Because understand, we're one big group. We're all podiatrists at the end of the day, right? So we need to be a part of both organizations. And again, if you want your voices to be heard, then we're the voices that are on Capitol Hill fighting. So now she's actually over this group called AC-DUCY. And you do not become president of APMA without going through AC-DUCY. Actually, Dr. Brooke Bisbee is part of AC-DUCY. So AC-DUCY are all the components that have less than 3 delegates. And you get a delegate from having 100 different podiatrists in the state, right? So you do not make it there without going through AC-DUCY. She holds a lot of power. And then Dr. Van Bass is to her right. He's the one that brought up the problem with Georgia having for getting reimbursed for doing call, okay? So save the date. Our legislative conference will be in March 17th through the 18th, 2026 in Washington, D.C. And please come out. Everybody has champions, right? APMA has their champions. NMA has their champions in government who support, their organizations. That means we can put all these champions together to get these bills passed, right? It just makes sense to me. So, and then I'm very grassroots, and like I said, now if you look to the far left, those are my 2 daughters. The short one, she's already a rising second year at Temple University School of Podiatric Medicine. And the one to my right, she's at North Carolina A&T. So, and she plans on becoming a podiatrist as well. This is our legislative day, we have Podiatry Day. I know most states have that. So we had that, and then, because I want them to see what it takes. I don't hide anything from them. They love spending money, but I tell them it's a lot to do when you're spending money, right? So come with me to Columbia, because they also want to hear from the students. And then this is the House of Delegates meeting when we were in DC recently. So we had over 100 podiatrists up on Capitol Hill, again, fighting for this legislation. And then just recently, last week, that's Dave Albert sitting in the chair on the hot seat on that top right. He's one of our Board of Trustees members, and again, he's presenting to get the scope passed and for the scope of practice to be passed in Massachusetts. And then again, we have our president, Dr. Bisbee, and then our CEO, Megan. That picture was also at in DC. You can go on.
I've got cards, Megan has cards, we will get you signed up, anybody across the country, we would love to have you.
And one more thing too that we should look at, that we do not have to reinvent the wheel. UPenn is even working with Meharry, where right now, so for minority students that want to go in, they're going to actually accept them into the medical school at UPenn as long as they have 3.6 GPA, they don't have to take the MCAT. So everybody, so look, there's so many things going on in this arena that we're missing out when we don't have the information. This is information we need to be putting out. So again, APMA has it. I constantly stay up on this stuff. So
for Clark Atlanta University School of Medicine, I mean university to take care of all their sports, and with the initiative of knowing that we're trying to increase the exposure of Black doctors to these young kids. Now, what you don't know, what I just found out was last year, Clark Atlanta had over 46,000 applications for 1,700 spots. Their entering class this year, its average GPA is 3.8 coming in. So there's a shift right now of young, talented people of color going to these universities, and they're seeking that. So what I would recommend is that there's collaborative efforts, like for you, you're right next to these schools. Find out who the team doctor is, who is there.
I used to be at Texas Southern for 21 years.
Exactly, and work with them,
yeah.
because that's what's going to be taken. Because we're starting to see that really sports is what's pushing the agenda in the world, right? And so clearly, in these, Deion, some of these kids are going to these universities proudly and choosing them. So as and that's great talent to know that for the first time, Clark Atlanta, they're entering GPA is 3.8. That's insane, right? So kids are deciding not to go to Harvard and Columbia and Yale and come into these schools. So as professions to grow, right? Well, no matter if it's podiatry or ortho, we got to push that agenda, right? Because I know in the world of ortho, we only make up 1.8%. Right, so there's to me I said there's more black pandas in extinction, right, being protected than black men going into orthopedics. So at the end of the day, but podiatry has done a great thing. Be in this room and see all these, the future of podiatry is great. So hopefully there's collaborative efforts that can happen, and I think that can start with these HBCUs and sports medicine and all that stuff. I agree.
So I these sports medicine physicians, I keep it 100 with them. I tell them you're not going to be the team doctor for Adams. I say, I say, but you can get a lot of experience on the college level, definitely the high school level, and have a fulfilling career in sports medicine. So it's one of the things I say, but you need to have a talent. If you're not an orthopedist, I say you need to do something that's going to pay your rent and have kind of sports medicine as additional training for you. But it is an amazing opportunity to meet and greet. I work with the NFL Alumni Association as well, and we do a lot of projects in Grand City, Atlanta, and nationally. So having that connection with sports, it automatically opens the door to a lot of young people that you wouldn't have access to, or more importantly, wouldn't have interest or access to you. But then they see you doing this and they say, hey, I don't have to be on the team, I can take care of the team. And I say, guess what? I say, you see, it's 55 of these guys out here. I say, there's 1 or 2 doctors. I say, so which one would you like to do? So again, something that keeps their interest, and that's kind of what we have to do. But I emphasize. I raise holy hell at Morehouse School of Medicine about the quote pipeline that needs to
about a year, heard from him, was with him for 21, 22 years. So, you know, I still had my practice, but it was a good augmentation to that, and I enjoyed working with most men and women athletics for 22 years. And it's a great experience for me. But I was the only black physician on as far as the team of doctors at Texas Southern at the time. Everybody else was white. So we don't see a lot of us in that arena, and you know that, Tom.
I know that, and as a sports doctor, there's a lot of foot injuries, right?
Tons. I stayed busy.
Tons. So I think that is a conversation to have, a collaborative event that should be pushed, right? And that's a way into the door.
So I want to hear one person first.
Following the NFL in terms of training, in terms of being sports medicine. So I thought she would address that, and I think she would have addressed the fact that they're very proud, Maharians, we are, that we have more male doctors this year, first year med students, than females.
Well, can't give you the total facts on it, but I know the wife has came down as the Dean of Meharry the last 2 years, based on the fact of pretty much coming in to increase not only enrollment and also the success of it. Being one that her background was able to teach on basic sciences, so they have had some great statistics as far as the rates being pretty high as far as on the scores on the boards. Not quite sure as far as the partnerships that's been formed as far as with the sports, but I do commend, and I know myself practicing up in Cleveland, and have taught at the podiatry school up there for 8 years, going back when I first moved from Jersey to Cleveland. But I would agree, definitely it's a lot of opportunity, and like the doc said, when I was in New Jersey initially practicing, I went back to my old college, small college, but volunteered, and basically was a foot door to say, look, and then your players have a foot problem, particularly if they're your starters and the key players, I'll see them for free.
Right.
Like you said, just to get in the door, and the reputation would build itself. And I've done that with many of my, particularly as you say, tying into the young people, I've tied in with even any young person that has a musical talent. And just by taking care of foot problems, but I've had them, they went on to Berkeley and send me pictures with them, violinists playing with Bootsy Collins. So, I mean, it can open up doors, you know, because they need all of us. They need the talent that we have. It's some we may take for granted. It's very much needed.
Thank you.
My question to everybody here is that, do you know your state rep, your state senator, and your congressman? And if you don't, go make an appointment with them and meet with them. Diabetes is bipartisan. When people get sick, they don't care what you look like if you can heal them. And so you get, whether they're Republican or not, don't matter. My congressman is Chip Roy. Y'all know who he is? Yeah. He's the most right-wing guy out there. Now, I have not met with him. But what? I woke up the other night and it was on my mind. God put that on my mind. I got to go sit down and have that conversation with him. I guarantee somebody's family probably got diabetes. No, no mercy. Yeah. So my whole point is that that's important, because they need you to educate them about what they need to be doing that affects their whole community. That's power. Yeah. It's amazing. Yeah. I guess that was the main point. There was something else I was going to say, but I forgot what I was saying. Oh, sports car. Okay. When I started in San Antonio, I wanted a sports guy for the San Antonio Independent School District. So I went out and met with the athletic director. I didn't know he was blind. It's a Hispanic town. Lord have mercy. We 2%. Yeah. So, but the key was, I wanted to be able to tell all the guys that I want them to make some A's and B's, because all of them ain't going to be in those LeBaron James or whoever they're going to be. Yeah. You can be anything else, but you may not be that. So those are the things we did. And I was in the orthopedic department, and Charles Rockwood wrote the fracture text. Dr. Heckman became the chair, And I was on the biggest lecture I gave was at the Academy of Orthopedics, not the Orthopedic, but the American Orthopedic Association, the academic part. And it was a thing called Quarterbacking Musculoskeletal Medicine in 2006, June. It was like 600 academic orthopedists there. And it was a session on quarterbacking musculoskeletal medicine. I was a foot and ankle center from UT San Antonio. I was a spine center from Vanderbilt, and a sports medicine center from Vanderbilt, and the other one was the spine center from Emory. And so we had to talk about the cultural, political, and financial barriers to why our centers existed. And it was amazing. So it's all about the coming together that you all were talking about, etc. But what happened was the spine center had to hire a chiropractor. When money gets into the thing and people need it, all this stuff goes out the window. And they realize that everybody's needed. But that dollar bill says, in God we trust, everybody else will show doubt.
We've traveled all over the last 6 months, and y'all have been one of the most welcoming groups that we've been to. We've really enjoyed our last 36 hours or so here, so thank you. And also a shout out to one of your own, John Dell over here. She has given countless years and hours to APMA and our committees, and both her state and nationally, and she's our current CPAC chair, which helps with state advocacy projects and things. So very big shout out to John Dell, because she's doing great work with the group on behalf of you all.
I'm sorry.
We are so proud of you. Thank you for being here. So on behalf of APMA, it is my honor and privilege to be able to present to you this certificate of appreciation. And I'm going to read it for what it says here. It says, a certificate of appreciation. The certificate is proudly presented to Debbie Burton. Presented to Debbie Burton, Executive Director of the National Podiatric Medical Association, in honor of her distinguished and enduring service. With over 3 decades of exemplary leadership, administrative excellence, and steadfast commitment to advancing podiatric medicine and health equity, Ms. Burton has made an indelible contribution to the profession and its future. Her legacy of service stands as a model of dedication, integrity, and visionary impact. Given this day, July 21st, 2025, on behalf of APMA, thank you so much for everything you've done.
Thank you. Played meal, because if you went to that conference, we had the room filled, and then there were still students lined up outside to eat, and I had to learn real quick how to bring in extra tables and chairs. But I never lost my love for this profession, even though I didn't have the doctoral background. I had the meeting planning skills, and that is what has helped me put this meeting on for years. So I'm glad that it's been turned over to a very proficient, where's Audrey? I know she had it somewhere. But this lady took over for me, and I'm glad that now you have a real certified meeting planner to help you guys through the future. And I love you all, and thank you so much.
We love you too. Love you.
I forgot about him.
Yes, he needs to come up and get a picture.
Well, he had to put up with me going through all these meetings and stuff, and even though he would only go and went to Vegas, he would still support me. Thank you all.
I remember when I was a student, first time I met you, I was a student through residency, through NPMA and then coming through leadership of NPMA and to where we are now. For those of you who don't understand who this woman is and what she means to all of us here, to this section, she is, you know, you got that, every archway has to have that one stone that keeps the arch together.
Yeah.
Right.
Yes.
Right. And it was none of us docs. It was this lady who was calling me, Jefferson, we got a plan B. Jefferson, did you do about A, B, C, D? You dot the I's, cross the T's, because NMA needs their paperwork. We have everybody lined up. And what do you need from me? What do you need me to do?
Right.
And she was working. Right? And even through her health challenges, she still worked with her. When we first did our combined, or our hybrid convention, we were in Atlanta. Debbie was here, working behind the scenes from Chicago while we were in Atlanta to help with those, especially to help with the virtual part. Jefferson, there's a problem. We can't hear what's going on the stream. I need you to fix that right now. And you know, and beyond that, beyond just meetings and keeping us together, wanted to make sure that we were all doing well and our families were doing well. Debbie always asked about my kids. Debbie, there's Jay, you see your boy right there. And you know, what you mean to us is beyond being an executive assistant. There's no word for it. Right. There's no definition for it. I mean, the best word I can come up with is family.
Yes. Yeah.
And everything it meant to us. Right. Okay. So from our section, I want to read this award. Let me get my glasses so I can see. That's how long I've been in this organization. Lifetime Achievement Award to Debbie Burton. In recognition of a distinguished career spanning 30 plus years as a section administrator for the National Medical Association Podiatric Medicine and Surgery Section, and as the Executive Director of the National Podiatric Medical Association, where her dedication and leadership have been instrumental in the mission, initiatives, growth, and success. July 21st, 2025, signed by myself and by our Vice Chair, Dr. Adrian Atkins. And see, Debbie, this is just a little token of what we could say that you mean to us.
Thank you.
So we hope we put it in a place of prominence, not just up on your wall at home, but right here. All right, you got it? Yes. Thank you.
I get that reaction. So Debbie, Dr. Atkins and Steve, it's time. Renee's on the phone. We're ready. And you guided me as I got into this arena. You guided me along the way on what's next to do and how to do it, who to contact. You gave me the history of the NPMA, the leaders that I did not know before I came along. So she always gives us history, and that's good. We need to know it. I thank you so much for your dedication, your service. I'm going to tell you, we've been waiting to get here in her hometown so that she could participate in person. And then when she said, well, I don't think so, she was the one, she was so devastated that saying that I just don't think I can do it. I'm like, come on, Debbie, you can do it. And she said, okay, I'll come. And that's who Debbie is. Right. Even if it's a challenge, she'll say, okay, I'll do it. So in recognition of you, we have this little trophy. NMA Podiatry Administrator Award of Excellence, Debbie Burton, July 2025.
Right.
And there's more.
There's more.
Y'all put this up there.
I'm gonna give it this call.
Thank you, Adrian. Dr. Sneed. I sometimes forget that I'm not a doctor and I will say the person's first name. But thank you again. You're sneaking up.
I got a little something to say,
A
No,
little
little
something.
something. No, I'm gonna speak on two folds. Many of us that's co-chairs, when we were students, we were also members of the Student National Association. I know myself, I think Kelly can remember back in maybe 93, 95, I was the president of my local chapter. And unfortunately, we almost didn't have a chapter because I wasn't selected as president, I was the vice president. But the president decided to quit. So when I put everything to a vote to the students who wanted to run, no one wanted to run for president. So I had to fill the position of president and vice president the entire year. And being able to talk to, at that time we had an executive director for the students, but also lean up to Debbie, who kind of was there for us to make sure that we didn't lose a chapter, because when a student organization loses a chapter, there's no guarantee that you're going to get that chapter back. And to be able to work that hard, we ended up winning the chapter of the year that year. And then the most important thing what Debbie did is that for me to actually be here, we had a thing called Hurricane Katrina, where a lot of us lost our homes and our practice, and we didn't even know we were going to come back. And she worked so hard to try to pull as many of us that was practicing in that region to come back, just to make sure that we were okay, making sure our families were okay, and knowing that she was the glue to make sure that NMA continues to reach out to many of us. And so for her being the person that she is and what she has done for this organization, you know, today is not just a sad day, but it's a day of remembering all the things that she's meant to this organization. Because I can tell you, you know, I was away from NMA for a while, because when I went through Katrina, losing a home, practice, trying to come back, that was not even on my radar. But look where we at right now. Look where we at. I'm here because of her. Because of her. You know, reaching out to us during the most difficult times. Whether you're going, even not talking about coming back to an organization, you're talking about even being able to practice again. And she was the glue. So Debbie, love you. We're gonna miss you. And we got a little card for you too. And the card reads, we would miss you very, very much. And we have a lot of everyone from this section to sign it. So we got some beautiful personal messages that, you know, you're gonna always have this to read, to remember all the good times, and we love you.
Thank you so much. I don't know what else to say, but you guys keep coming up with stuff. And I have to admit, I was aware of some of the stuff that was being planned because they forgot to take me off the text chain.
Debbie's on here, Debbie's on.
And when I saw that, I was like, oh, wait a minute, something's going on. I remained mute until they were finished, and then I told them, you know I'm on this text chain. I thank you so much. You guys will always be in my heart because you're my babies, and I really appreciate having worked with all the professional people and teaching me how to be. I'm looking at you, Dr. Harkless. Because when I came, there was a doctor by the name of Raymond Lee.
Yes.
He was the one who unfortunately didn't make it to that meeting, and he asked me if I could do it, and I said, well, I'll do the best I can, and the best I can is in this room, and I want to thank everyone so much. What else y'all got?
I'm gonna go back to the nitty gritty. Debbie's my road dog, okay? Every Tuesday and Thursday after work, where do we go, Debbie? The bar.
To the bar.
The bar. I must say 90% of even my national committees, any committee I was on, any credit that was given me, 95% of the work she did. Wow. She has been my right hand, and I miss her so much since she's been sick. But we're gonna go to the bar again then. Rum and Coke.
I will not keep you guys long. I have Dr. Atkinson Sneed to thank for having the pleasure of meeting you. Yeah. I knew when I first met her, I said, oh my God, I'm gonna have really big shoes to fill. But you warmly welcomed me. Yes. And I worked my butt off for this group, but it's because of you, because I know the expectation. Yes. All right. And I thank you.
I thank you for stepping in.
Now, last thing, got some goodies, but I've been a little busy, so I didn't get a chance to put this in an envelope, but that's a $175 gift card, and I got some more money today, so I'm gonna be sending you another card, and there's some other goodies in here, and we got these beautiful flowers. Thank you, Debbie.
Y'all gotta stop.
Thank you.
I don't know what else to say except I know y'all want to go and eat and do something other than looking at me sitting here crying. I love you all. Thank you so much. I love my husband who has put up with me. I love every person in this room. And I know that this organization is only beginning. I know when we had to merge over from the NPMA to the NMA, and those people who served multiple presidencies like Dr. Caldwell and Dr. Renee, you know, Dr. Foster, everyone has stuck with this group because it's a positive thing. It's something that you all have an investment in, physically and mentally. And I love you all and thank you so much.
Okay, I am the lucky one. I've been married to this woman for 52 years.
Amen. Amen.
I know how hard she works. I know what kind of person she is. She's dedicated, she gives 150% in whatever she does. So through the years, I was offended by this organization, by the church organization, everything she was affiliated with. I used to have an attitude because she worked so hard. And I used to come home and say, would you please sit down? And she'd be up all night, all day. And I say, do these people really appreciate you? So through the years, I was definitely offended to a lot of, because I felt that she was being taken advantage of in a lot of situations. You know, sometimes you don't know the sincerity of people. But coming here today, I apologize. I thank you. I see that you genuinely love my wife, and I appreciate you, and I'm humble and gratitude. Much gratitude to the organization, to the people, and to the family.
Right.
Thank you.
Yeah.
Give it.
30 years. I think it's closer to 50 years that you've been involved with us. And emphasis on the word grand. Emphasis on grand.
That's a wrap on this special live episode of First Med, a ProMed podcast with the Johnny and David Show. But we will be giving you coverage all week long, live from Chicago at the National Medical Association Conference. Be sure to follow us wherever you get your podcasts. Drop us a 5-star review if you're feeling the vibes. And follow us on socials at ProMed Consulting LLC and K.L.P Entertainment. Signing out for now from the Johnny and David Show.